Chapter 10, Health Promotion of the Infant and Family. This is where the book divides up the different ages, and we looked at neonates last time, and now we're up to infants. So when we're promoting optimal, one of the things we want to do is promote optimal growth and development. The first year, this is where kids just really grow rapidly, and especially during the first 6 months. Those first 6 months, the changes are dramatic. They're gaining, this is proportional changes, they're gaining 5 to 7 ounces per week. That's just about an ounce a day. That's during the first 6 months of life. It does slow down a little bit after that. They should double their birth weight by 5 to 6 months of age. They should triple their birth weight by 1 year of age. Their height should increase about an inch per month during those first 6 months. Now it's not going to be exactly the same every day. They'll have spurts where they grow more for a few days and then they slow down for a few days, but overall that's what they'll be gaining. Their systems are maturing during this time. The respiratory system starts out pretty immature, and they're very prone to respiratory infections. Now there's a couple reasons for this. One is they're just so small, everything's close together. So germs in the mouth are right there by the trachea, and the trachea is very close to the bronchi, so it's easy for something to travel all the way out into the lungs, where for an adult it's in your throat, it's pretty far away from your lungs. Another problem is the eustachian tube is short and straight. The eustachian tube is supposed to go from your middle ear, and it goes down into your throat and opens that up. Your middle ear actually has air in it, and so that's the tube that allows the air to get in there and to drain any fluid out because it's heading downhill. On a baby, it's short and flat, so if there's fluid in there, it doesn't really drain anywhere. It just stays there because it's flat. And that's what makes them so prone to those middle ear infections, the otitis medias. They also have an immature immune system. They don't produce very much immunoglobulin A, and that's the main immunoglobulin that's in the mucosal lining in both the lungs and the GI tract. Cardiovascularly, what's maturing and happening is they are going through some hematopoietic changes, which means making hemoglobins, red blood cells. They're having less and less fetal hemoglobin, and by 5 months all the fetal hemoglobin's gone. It's all adult hemoglobin, and that the percentage of fetal to adult is kind of tapering off during those first 5 months, and the adult is increasing. But while they still have that fetal hemoglobin, it has a shorter lifespan, each RBC does, so each hemoglobin's not lasting as long. It's got to be made faster, and this tends to cause a physiologic anemia around 2 to 3 months. They just have this dip where they're a little bit anemic at 2 to 3 months of life. They are able to make the hemoglobin because they have iron stores from the mother that's enough to last for 5 to 6 months. After that point, that's where we start adding in iron fortified baby cereals, though, for that iron. The GI system. Their GI system is very immature. They don't make a lot of saliva. Babies don't. They start producing more saliva about 3 months, which is where they start drooling. And part of that is just they're not very coordinated in producing the saliva and swallowing it. They also have less enzymes for breaking down food. So their digestion kind of occurs very little in the mouth because they don't have the saliva and the enzymes in it. But some happens in the stomach. That's mostly just by the hydrochloric acid and the renin. Renin curdles the milk and makes it into little curds. Some happens in the duodenum by the pancreatic enzymes and bile. Fat absorption. They're not as good at fat absorption, but that increases, and by 4 to 6 months they're as good as an adult at being able to absorb fats. And solid foods in general, they just don't break things down. If they're given, a piece of corn or a piece of a vegetable, it comes right back out in the diaper. And the liver also is very immature, and that's something to think about. Most of our medications are either metabolized in the kidneys or by the liver, so remembering that their liver is not mature. Okay, and their immune system, that's not mature. So the first 3 months or so, their immune system may not be mature, but they've got a lot of immunoglobulins from the mother, the IgG. Those taper off, and by the time they're 1 year, they're at about 40% of the adult level of IgG. So they are, more prone to infections. Thermoregulation, another thing that they're just not very good at. This does mature during infancy, and it improves, but really it's the neonates are not good at this, and it gets a little better though. This is where our capillaries dilate to, when we're hot, to let off some of that heat and constrict to hold heat into the core. And neonates can't do that, and they slowly start learning to do this. Shivering to produce heat, thermogenesis, and then they're starting to get a little more adipose tissue, that fat store that works as insulation to help them maintain their body temperature. GU system. This is where babies really are very different from adults. The other systems, it's more of an immaturity. It's just different. Babies have a lot more water. 75% of their weight is water, where an adult it's 55 to 60%. And that extra water is primarily extracellular. 40% of the water in a baby is extracellular, meaning it can be intravascular or interstitial, but it's outside of the cells. For an adult, there's only 20% there. Now this will decrease during infancy, so during that first year it's getting less and less, but having all that extracellular water really predisposes them for fluid shifts between the 3 different compartments, the intracellular, extracellular, intravascular. By extracellular, there's intravascular and interstitial. So it predisposes them to that, fluid shifts, and it predisposes them to dehydration, to losing the water. Part of that is their kidneys are immature, the renal system, and the kidneys really don't mature until about 18 to 24 months of age, the second half of the second year. And prior to that, they can't concentrate urine very well. If we don't drink a lot, our body keeps the water that we have by concentrating our urine. It reabsorbs it. A baby can't do that. They still will have very dilute urine, and a lot of urine for their size, and they can't change that even if they're not taking in enough fluids. Fine motor development. A baby initially, if you put something in their hand between 2 and 3 months, they can grasp it. They do have a reflex where their hands are usually pretty tight and pretty flexed, and if parents will think they're holding on if they stick a finger in there, but they're really not grasping an object intentionally till 2 or 3 months. But you have to put it in their hand. They can't reach out and grab a hold of it until a little bit after that. By about 7 months, they can grab an object in one hand and transfer it across the midline of the body over to the other hand. By about 10 months, they can do a pincer grasp, and this means using their fingertips, sort of, I don't know, pincer grasp. I can't think of a different way to describe it. We have a picture coming up. By about 11 months, they can remove objects that are inside a container, and By 12 months, if you give them blocks, they can build a tower with 2 blocks, just one block on top of another. And I have a number of pictures coming up. This is just the beginnings of a pincer grasp. You can see he's got a finger wrapped around that toy. Pincer grasp is using the fingers and the fingertips rather than the whole palm of the hand and all the fingers wrapped around something. And here he's got very good finger control. You can see he's actually using single fingers to push things. Gross motor development. At birth, a baby should be able to turn its head side to side, even when prone. When you lift them up from supine, there should be no more head lag at 4 to 6 months, and I have pictures of that come from your book. At 4 months, a baby should, when prone, should be able to lift its head up so that the head is the top of the head's pointing straight up at the ceiling, so 90 degrees up. 5 months, they should be able to roll from abdomen to back, and at 6 months, roll from back to abdomen. They're sort of like a turtle. They get rolled over and stuck on their back. 7 months, they should be able to sit alone without you supporting them. 10 months, they should be able to move from prone to up to sitting position. And here's pictures of the head lag. When you pull a child up by his arms, you can see the head just hangs back. The head's big and heavy and the neck is not very strong. B, the child's head's about, drooped back a little but not much. He's trying. And C, he's got his head totally pulled forward there. There's really no more head lag. And here's head control. When you put a baby prone, initially they can lift up their head a bit for a short time. That's picture A. Picture B, this is where they can get their head up 90 degrees from the surface they're laying on. That's at about 4 months. And in C, this child's actually, he's not quite there, but almost where he's getting all the weight on his arms. So his chest is up off the ground and he's got his forearms flat on the ground, holding his weight up on his arms. And that would be about 6 months. Sitting, a newborn just really has no strength to their back. If you try and put them in a sitting position, they're just curved over. And you can see picture B there. This baby's about 2 months old, and he's still curved at the lumbar area. He really doesn't have any strength, but the back's relatively flat. At C, he doesn't have the balance or the strength to hold himself up without some help, but he's able to keep that back fairly straight, fairly erect, where the head is up, the head's not pulling him forward. A baby should be able to sit on their own without needing support about 7 months, but they may still be leaning on their hands, which is picture D. She's still using that one hand to support a little bit, but by picture E, by 8 months, he's not needing any kind of support, and in fact he can transfer objects here from hand to hand.